You're listening to the Turn Autism Around podcast, episode number 202. It's kind of fun to say. Anyway, this week we're doing part 2 with Zulekha Williams, all about her son Maddox. And this week we are talking about his severe problem behaviors, including self-injurious behavior and aggression. Also, her struggles to find schools and programs, ABA providers in rural areas. And her desire to actually move for better services. So we talk about all of this in part 2. Let's get to this important episode with Zulekha Williams. So let's talk about his self-injurious and his tantrums and his meltdowns. Whenever you say meltdowns or tantrums,
there's a difference with Maddox.
Okay, well, whatever you call it, because people call it different things. Like I rarely use the word meltdown. I use the word tantrums, but even as a behavior analyst, that's not technically that great of a term. But so whenever we use whatever word, problem behavior, meltdown, tantrum, whatever. So I need to know, what does that look like? Okay. What behaviors does he exhibit during whatever, a meltdown?
Okay, so for a meltdown with Maddox, it will sometimes and can last up to 30 minutes, an hour. I'm going to be very honest. And he will initially, let's say so his last meltdown, let's talk about that one. His tablet died because there's issues with his tablet, not his AAC talker that's on his iPad, but his different tablet for his gaming and watching YouTube, super simple songs and stuff like that. So it died. He throws it, or he'll start hitting himself on the head repeatedly, and then he'll throw it. And then he'll turn to me if I'm right next to him, and he'll start trying to hit me, kick me, or his little brother, or who's ever next to him. And if then I move away, then Maddox flops to the floor, and he's laying on the floor just kicking his legs up and down like this a bunch of times. And he jumps up and he throws everything he can throw. Sometimes I feel like he would throw me if he could, because he tries. So he's running all over the house, screaming, crying, and then you try to pick him up like this, and he goes to you, but like is almost to you, and then completely falls to the ground again and starts kicking and throwing and running around the house, screaming. So for us, that's a meltdown for Maddox. When I'm trying to console him, I can't console him.
And how often does that happen?
Oh, a lot right now. So right now it's happening. He had his tablet a lot during COVID when he was sick. So he's having a hard time breaking away from that. So his meltdowns have went up a lot. I would say yesterday, Maddox probably had maybe, I don't know, at least 8 or 9 meltdowns. And that's a lot for me. I'm sorry. I know some kids have more, but I would say he probably had about 8 of them yesterday.
And they all lasted multiple minutes?
Yes.
Okay.
More than a minute, more than a couple minutes. Well, then what will help him out down, sometimes, deep pressure will help him, but that's after he's calmed down, or these lights,
So what calms it down? What turns it off?
What turns it off is if his game will work, that'll turn it off sometimes, or he'll keep going for a while and then calm down. Or I will just sit next to him, and if I talk, that's a trigger for him during a meltdown. So, if I try to console him by talking with words, so I try to not talk as much as possible. So for me, staying calm, that helps a ton. If I go, get upset, which I'm a human, sometimes I get upset because I'm trying to move his little brother out of the way, and I'm like, oh my gosh, how can we get through this? And that's too much talking for Maddox. So just me staying really calm helps the most. And or if I happen to get something on YouTube really quick that shows all the flashing lights, that calms him down, because then he's just like so amazed with these lights, just lights flashing on the screen. So something like that'll calm him down. Or it happened in the store when we were in Las Vegas with my mom, and I had to completely pick him up and carry him to the car, and that calmed him down just to be out of the environment. So an environment change can help as well too.
Yeah. So give me an example of something that triggers a meltdown that's not related to an iPad or tablet.
Food.
So
Okay, so since Maddox has done this thing with food since he's probably 18 months old, if I sit down to eat and start eating, Maddox gets upset about that. Like he doesn't want to watch me or see me eat. And it's only me and his dad. He's okay with his brother eating. And that's went down a lot recently, maybe in the past year. But to see me eat, sometimes he gets very upset, extremely upset.
And he's not eating, or does he have a plate of food?
He has a plate of food too. So even sometimes for him just to see food, like I walk in, say to his little kid's table yesterday, I brought him a sandwich and I brought his little brother like eggs, and because his little brother likes a lot of different food. And I put them both down on the little kid's table, and Maddox looked at both of the plates and he threw his tablet and started crying. So just to see food as well too will upset him. Unless it's like a bag of chips, that won't make him cry. But when it's a meal, that upsets Maddox to see it. Not all the time, but I would say a lot of the time, maybe 70% of the time, just to see a meal coming, he gets upset about it.
It's very strange. Is
That's what his therapist said.
is his height and weight okay? Is he growing normally?
He's growing normally, but Maddox didn't gain weight for probably almost a year. He's just started gaining weight recently. Like he doesn't have failure to thrive or anything like that. He put on a couple pounds this year, but for a year he put on no weight.
So I heard you say something when we were doing the assessment about PediaSure. Do you use PediaSure recently?
PediaSure has helped a lot to help him to gain weight. I've personally noticed, and because then I will do stuff like put some eggs in a PediaSure and blend it up, and he'll drink the eggs with the PediaSure. He can't tell for some reason, and I love it. But PediaSure helps. I personally don't want to keep giving him PediaSure though.
Yeah. See, I really do think that a feeding evaluation, not just a person coming to your house, but like at a clinic, a feeding evaluation, even with the whole mouthing and sucking on his hands and drooling, like the fact that he's so extremely picky and those sorts of things, it really does make me concerned that there's a medical, issue. I did a podcast with a functional medicine nutritionist, like a functional medicine physician who specializes in autism might be helpful, because the whole PediaSure, if you're giving him PediaSure twice a day to like slip things in and to, get his vitamins in and that sort of thing, that's not a good long-term solution.
No.
Raw eggs are probably, you're not cooking the eggs, you're putting them in raw.
No, I actually cook them.
Oh, you cook them and just blend them in. Yeah. So that's okay. I was like, I don't think
raw eggs you can.
Yeah, that would be gross. And I don't think it would be safe either.
No.
But slipping things in and feeding kids when just to kind of gain weight or provide nutrition isn't really the best, because they need to get hungry and then they need to eat. And so if he's grazing throughout the day, if he's filling up with a PediaSure, within an hour or two of a meal, he's not going to, maybe some of the reason that he threw his tablet when he saw a meal was because the meal signifies that we're putting the tablet away.
Yeah, I pair the tablet with a meal. So that was why I initially gave him his tablet, because I knew I was bringing a meal out.
Oh, okay.
He would be okay.
Okay. Yeah, it sounds like he's having really pretty significant problem behaviors. So you said it got worse because he had COVID recently.
He had COVID, which means he got his tablet a lot more because we all got COVID. So it was hard for me to just, I'm sick and I'm trying to take care of everyone at the same time. So I gave him his tablet so that way I can try to heal as well too.
Right. So is he having these kind of meltdowns with his ABA therapist when you're
Yes.
not home or not?
I'm always home with him with ABA because I don't want it to go too far. Not that she's great, by the way. I don't have anything bad to say about her, but I know how Maddox is, and I can calm him down quicker than his ABA therapist. So that's why I do try to stay in the room, but I want to pull apart as well too. But yeah, he has them, and then we stop because he's not going to learn anything if he's crying and upset. So we stop and we do something else. We go outside or run around. He likes to just run around. I taught him how to play tag, so we'll play tag for a little while. That way he can run and get some energy out.
Yeah. So does he also, in addition to this person that comes for 5 hours a day, he has a behavior analyst, right?
Yes, he does.
And how often does that person come?
Once a week, sometimes, and usually through Zoom.
So not in person.
Not in person. He might come in person maybe once a month. So not often. And the thing with ABA as well too, because we're so secluded on this mountain, Maddox has went through four ABA therapists since he started in January. So once someone, quits or does some whatever, puts on a leave, then Maddox goes 2 months without having ABA. He just went 2 months so 7 weeks without having ABA. He just started ABA again last Monday.
He went 7 months without
7 weeks. 7 weeks.
7 weeks.
Yeah, 7 weeks.
Oh.
So in between each therapist, it's at least a month, and then he has someone new. And
has to pair and has no idea what to do. Wow.
And usually it's a new therapist Maddox is their very first person ever.
Okay. So it sounds like he's really having a hard time transitioning to people, to activities. One of the things I'm hearing, and you're just trying to survive.
Mm-hmm.
You're just trying to calm him down as quickly as possible, and so he can get on to learning, which is totally normal.
Mm-hmm.
But I hear a lot of, you're trying to calm him down in the moment, and you're needing to use all these reactionary, deep pressure, bringing him out of the store, bringing him outside from ABA therapy. And those changes in the environment and what you're doing, just you're really finding it hard not to use these reactionary strategies. But what he's learning is, if I throw my tablet and start hitting and start running around, then I get better things. Then your mom's phone comes out. I get deep pressure. I get to go in the backyard and run around.
Mm-hmm.
And so I have this in, I think, both my books. So if I gave you $1,000, the therapist is coming soon today. If I give you $1,000 for Maddox to have no meltdowns today, or even for half the session,
mm-hmm.
what would you do?
For $1,000 for him to not have any meltdowns, he would have his tablet the whole entire day.
Okay. But he might still have meltdowns because the tablet may break, or he may get bored, or you're going to have to feed him something.
Right. So if say the battery dies on the tablet and then he does have a meltdown, I would maybe have a favorite book ready because he loves books, or start singing to him. He loves music. He loves songs. What else?
Is that like music and songs? Is song time built into ABA therapy?
Yes, it is.
is book time built.
We call it circle time because at school they have circle time and that's what they do at school. So we're trying to help him in the school setting as well too by having circle time at home. So watching some, like I said earlier, happy, clap your hands or different super simple type of songs. He loves those. So we'll do usually like 3 or 4 songs in an ABA session.
Okay. So, part of my course and everything I preach is spend 95% of your time preventing problem behaviors, which it sounds like it's a tough situation because you want to get out of being there constantly,
Right.
but you keep having changeover of staff.
Exactly. And I'm trying to go back to work too. And right now it's seeming impossible right now.
Yeah. So I know you don't have time to watch my course, but you left, which, a lot of people do. And I was telling you beforehand, like you recently came back, but we used to have a pretty clunky transition from the toddler course to the verbal behavior bundle. We changed everything about that. It is so much smoother. The community is completely positive. You stay for a year or month to month, but at very low price, like 2015 pricing. Anybody out there listening that used to be in the course or courses and left, probably because they got busy like you and they have ABA and like, why would I need to still be a part of the community? We really urge all parents and professionals to email us at info@marybarbera.com. If you've ever been in the course, we are still offering 2015 pricing right now for a limited time to come back. But I really do think, Zulekha, that you did well with the toddler course. He was learning, and I do believe that some of the answers are in the course, we have a mini course. So you have access to the course now. It's called No More Timeout. But we're actually changing the name because it really is just preventative, positive, and then reactionary strategies that you should use. And so it's going to be called Turn Tantrums Around. Because really it isn't about timeout, because most moms like you and I aren't really using timeout. We're just trying to get through the day.
Yeah.
I think the videos in there and and it's only an hour and a half. So I would say that would be my first tip, is to watch that course. I would also look at those chewing and mouthing video blogs, see if you can schedule some kind of evaluation, look at the food lists, and maybe instead of just bringing out a sandwich, you bring out a very small sandwich with some chips and some other easy foods, or maybe just serve him easy foods, like the foods you listed that he would eat, pizza, this, that, serve him easy foods. If you think that might help prevent a meltdown, that's all about it. Think every day. If I have $1,000, what would I do? So for now, you are going to unfortunately have to stay in therapy with the new therapist and pair up things. And I would, even though I'm against moving, for most people, picking up and moving isn't necessarily the answer. I do think that he will benefit more from a structured, potentially in clinic, in school, but that BCBA and that therapist has to be highly trained, has to believe and use the BB map, not just for an assessment, but for programming. They need to believe in my approach, the Turn Autism Around approach, and believe in preventing problem behaviors. And I really do think that it's a critical time for you to get the supports needed, because he is suffering if he's having this many meltdowns. And then when he does have a meltdown, if he's hitting you or hitting his brother or hitting himself, take weapons out of his hands, keep him safe. Don't let him bang his head. Don't leave him alone. Protect his head like his life depends on it, because you do not want him banging and you don't want him to be aggressive. If there's a soft area where you could take him, And at this point, you know, he's small enough that you can carry him and get him into a safe environment most cases. That's not going to be the case for very much longer. So I
What
do
we noticed too is when he started school August 1st, that's when a lot of his behaviors escalated when he went back to school. So we're right now thinking of not doing school anymore because where we live, it's they have he has a one-to-one, but they have lack of staffing. So that way his one-to-one isn't always being used just for him. You know, she's being pulled everywhere else. So even just the look on their faces when I pick him up, they look stressed out. And even his teacher asked me, she's a first-time teacher, you know, bless her heart. She was a teacher's aide last year. She's, you know, still going to school right now. His whole entire staff changed. He loved preschool last year. He absolutely loved it. But this year, he gets so upset just to even see his school. So I don't really feel like school is he's only 4, but yeah, I don't feel like it's very beneficial for him, at least in that classroom. And I had a conversation with his principal, and his principal agreed, you know, maybe, you know, one of the other schools in the district off of the mountain would be better for Maddox because they do have more experience. So we're going through that as well too. So yeah.
Yeah, I wouldn't take him places where he's, you know, throwing a fit to get there. If he's having major problem behaviors, if he's banging his head there or being aggressive there, we need
banging his head there too. That's the thing.
right. And so, you know, I feel like this whole podcast is now like, I'm giving you so many things, and I feel like it's so stressful what you're saying, what I'm saying. There's so many facets to it.
Right.
But I do think that he's communicating that he needs a different situation. He needs, you know, fragmenting school versus ABA versus feeding versus OT versus, you know, this is what happens. People get different advice. And unless you have like a very systematic behavioral program in place, it's going to be hard to turn it around.
Right, which we don't, because things keep changing with him, with his ABA, and his whole school staff changed when he was loving school. So it's like, yeah, like I said, all the problem behaviors escalated when school starts. And then after he got COVID, and then, you know, new therapist again. It's like there's no consistency other than mommy and daddy and little brother. But everything else is so inconsistent for him right now. So it's hard, and it's hard for us as a family too. And I'm trying to be as transparent as possible. This is our life right now. As things change, it gets worse for Maddox, and then, you know, his little brother, us as a family unit in whole. So we want the best for him, of course, as any parent would.
Right. Well, I do think, I know that you had sent in another question, like, how can you prepare for like teenage years or adulthood or whatever? I think right this second, you should just focus on him being 4, him having severe problem behaviors, him having very limited communication skills and early learner skills, and use this year, 2 years, when you are going to still have a lot more input than you will when he's school age, unless you decide to homeschool him with support or keep him in full-time ABA. I would really look at where you can move, where has the best services. When I tell people, you know, to look for people that embrace my approach, it's very limited right now, but you can find providers who do not just use the assessment, the BB-MAP assessment as a one-time every 6-month gauge, but actually set goals from that, set programs from that. Maybe they have a multidisciplinary team where they would have a feeding ABA component, and they would have speech that was also very knowledgeable about ABA, and they would have OT that was also being supported.
That's what we want.
And and find somewhere that is going to work for your family. That's, I mean, I wasn't expecting when we began this episode to be like, okay, just move. And it's not going to solve everything. I think there's a lot you can do before you move. And for those of you listening that are like, I can't move. I mean, I'm in a situation where this is where I grew up. This is, and so that's
us right now. We can't move right now. Maybe we're trying to move as soon as we can, but moving costs. We can't just up and move right now. I have to help Maddox, be somewhat happier in ABA. And then I need to go back to work so that way we can move. So it's not something that can just happen immediately. No, it takes time.
Yeah. And so for now, I mean, maybe you could work with your ABA provider to be more involved. Maybe you could hire somebody, maybe a friend's, college student, daughter, or maybe, somebody you can go on care.com and hire and feel good about. Maybe there's a babysitter that could transition into being his ABA therapist and get trained. You know what I mean? Like maybe there's some way where you need a consistent person, not changing all the time. And I feel like you need a behavior analyst who is going to come in person and also be positive. And
how often should a BCBA come?
I don't know what is provided, like how many hours and that sort of thing, but I do think that meeting on Zoom isn't ideal. And I also think that it doesn't even matter if it's a BCBA or not. The person that is working with your son should really know how to apply all the techniques you learned in the toddler course, all the techniques that are in the BB bundle. It's not just a matter of I got ABA or have a BCBA. It doesn't, some Zoom therapy, I have friends that do distance consulting on Zoom. And I mean, all my stuff is online. We've never met in person and we may never, but that doesn't mean it's not helpful. It's just, we have to get back to that 95% preventative model. We need to look at his medical issues, if there are any, that's causing chewing and drooling and picky eating and self-injurious and obsessiveness.
He did just have his neurologist run his blood work recently, maybe 2-3 weeks ago. So very recently, but what he looked at was more so his vitamins, nutrients. Is he anemic, things like that. Because I took Maddox to the pediatric ER and I said, my son is pale. He keeps getting pale. And to me, he's still pale. So that's why I keep thinking in my head, what is he lacking? He must be lacking something. There is something else going on that we're not knowledgeable of or, aware of. So yeah, it's hard. It's hard as a parent when your child hardly wants to eat or is so incredibly picky and you can't always get the right things into them. And then, things changing with school. And then what is he really doing at school? I don't know what they're doing at school, even though they say, yeah, when you leave, he doesn't cry anymore. I don't believe that. I don't believe that.
Do they give you communication? Like if he hit
Yeah, there's an app that they communicate with. And once, since he started school, I've been sent one picture where he's smiling. But that's about it. They send home these sheets where they just check stuff off or circle things, use the bathroom, pulled down his pants, or liked art, or just stuff like that. But it's not like detailed communication. I communicate thoroughly with them. Each time something like this has happened to him, I email it straight to the principal because I want him to know this is what's going on in this school. Something is not right, especially something is not right if the whole entire staff changed this year. What's going on with that? So Maddox is not going to go to school anymore. At least right now. At least right now, we're taking him out because I don't know what's going on. And if he's getting so upset about school, that's not what he did last year. And so many of us parents are going through the same thing. Should we keep our kid in school right now, or should we take them out and just homeschool them? Yeah. And this is the route we're going to go. We're just going to homeschool for right now until we figure, what's next.
Yeah. Well, and one of the things you could look at, and I think I saw on your TikTok that you work with an IEP coach or a specialist, is not to just withdraw him, but to put in writing that he needs home services. He needs,
Right.
like
Right.
not just withdraw him and do it yourself.
I think she called it homebound, or there was a specific
Homebound
word for it.
services, and he needs, coordination with your ABA provider and those sorts of things. Like, especially since you're not moving, tomorrow or next month or in the next couple of months, you wanted to get him calmer with, and your goal, my goal for him would be 0 major problem behaviors.
Right. Mine too.
Major problem behaviors at or near 0, and be as safe, as independent, and as happy as possible. Those are my goals for every child. And I wouldn't stop until you get them there. Not to say that, just a few days ago, my son had self-injurious behavior. We have a calendar. We mark that in the calendar, in a regular calendar. He also has a rash. Is that some kind of impetigo? It is hurting. He told me that, like he's due for an allergy shot. Like, I am on it. It's like one pops out and I'm on it. We're going to get that back to 0. You know what I mean? So you're like far away from 0, but know that that is a possibility and that should be the goal. And you are an incredible teacher and advocate for your son, and you can do it. So
we can all do it.
just know that, it is a tough time. You are back in the course. You just got back in the course and community. So, I gave you some ideas. I know the time is hard for you to piece together when you can actually watch it. Put it on double speed.
Oh, I'm gonna watch it very soon. As soon as you put it out, so I can take some notes and say, okay, this is what she did. This is what she said.
So, and then I think you're really doing a very good job of trying to hold everything together and trying to do what's best for him. So never, think like, oh, don't even think about when he's 14 or when he's 24. Think about right now and trying to help your son get those major problem behaviors down. Maybe not to 0 at this point, but maybe, think of that $1,000 day, like be the spoiling grandma, be the one who's going to bring, the food he likes, have a regular schedule, very long cord to charge his tablet, have a schedule where that tablet gets charged every single night while he's sleeping, like maybe have an extra tablet, maybe have an extra device that's always charging. Like, I know that seems like
that too is, I don't want him to be on his tablet all the time, but I don't want him to hurt himself at the same time.
And hurting himself is going to really impact him much more than being on the tablet. So you can't go from 100 to 0.
Right.
So for now, $1,000 not to have a problem behavior. So now you got to get him comfortable, calm, not throwing tantrums. Forget about hitting my head as an option. Forget about throwing stuff as an option. Forget about hitting people as an option. Like, get him calm. And then once it's calm, your reinforcement is super high, your demands are super low. Now he's in a calm state for a day or 2 or 3. Now we ever so slightly, we can start setting visual timers. We can start, doing, a visual schedule, maybe song time, and then the iPad, and then pair it together. You kind of have to just, when we see problem behaviors, demands are too high or reinforcements too low. So we just swap that, make reinforcements super high, our $1,000 day, and demands really low. And then we start inching it back. And in the meantime, as you do that, try to make time to watch some of these things that I'm recommending and and to make some phone calls and to.
And I do have a question though too before we are done, because myself and a lot of parents are going through similar things. So specifically in regards to his mouthing and his chewing and his, chewing on his shirt, when we call our pediatricians and go into these appointments, what specific maybe test do you suggest we ask for, or if you've heard we should ask for? Because sometimes, pediatricians were, well, I don't know. Well, what do you think we should do? So what is your advice on that when we walk into these pediatrician offices?
Well, I am not 100% sure. When Lucas was chewing, I didn't know any of this.
Right.
I would definitely look at the zinc level,
Okay.
magnesium level, the copper level. There is some stuff about the zinc to copper ratio, which is abnormal in kids with autism. So a lot of kids need zinc supplementation. I did do a show with Missy Olive where we talked about that. You can Google zinc to copper ratio in autistic kids, but you can't get a test for the zinc to copper ratio. You get a test that does zinc levels and a test that does copper levels.
Right.
And then more cases than not, it's the zinc that needs supplementation, and you need to avoid copper. Like somewhere, I think it was are medications and supplements good for kids or bad for kids? And I give the example of like when Lucas was like probably Maddox's ages, or maybe a little older. I wanted to get nutrition in, so I gave him a multivitamin, not realizing that the multivitamin had copper in it.
On that video.
And so copper is very bad for Lucas. And within like 20 minutes of giving him a multivitamin crushed up because he wouldn't take it, he would freak out. And I'm like, what is going on? And so I put my registered nurse hat on, and then and I was like literally chasing my tail for many years. So it's not just about what test should order. It's about doing the assessment. How much does he chew? Does he chew on mulch, which is more like pica? Is it chewing on shirts? Are his shirts extra big so we can get it up to his mouth easily? Maybe put him in smaller shirts, or shirts with no sleeves if he's chewing on his sleeves. And it doesn't have to be an all or nothing. You don't have to throw the chewies away. I wouldn't do that, because if he's chewing on dangerous things, chewing on chewies is
better. Yeah.
Yeah. So I guess everything I'm saying here isn't like, this is exactly what you have to do. This is just one of the things to think about.
Okay.
Yeah.
Yeah. No, this is great. Thank you.
Actually, chewing, drooling, talking, feeding, it's all the same muscles.
Mhm.
I did do a show with Mags Kirk, who's an SLP BCBA, on talk tools, which is like biting, chewing, swallowing. If I had a 4-year-old non-speaking child, I would definitely be looking into that as well. But there's only so much you can do.
Right.
And even if money were no object, time would certainly be an object.
Right.
And waiting lists and information. But listening to Mags Kirk podcasts, exploring mouthing, chewing, maybe getting zinc and magnesium and copper. And there may be others. Like I'd look at the lead level, I would look at the iron level, I would look at those sorts of things, and those can be done. And a lot of pediatricians are looking for like, what test are you wanting? And that's where like a functional medicine doctor might be needed. But again, that might not be included with insurance and all that stuff. So it is, and we do need to wrap up. This is probably going to be our longest podcast ever, Zulekhas. Maybe we'll even break it in two. Who knows?
Well, I had to take advantage of you since I finally get to talk to you.
Do a weekly show, right?
Right.
Talking all these issues. I mean, you are doing a great job, because it is complex, and every child out there is complex, but
Right.
you are holding it together and trying trying. So before I let you go, people can find you at Zulekha Williams on TikTok, and
On TikTok, yes.
Zulekha is Zulekha. KHA. All of these show notes was going to be super long. All right, marybarbera.com/01.
Right.
And before I let you go, what part of my podcast goals are to help parents and professionals be less stressed and lead happier lives. So we just talked about your incredible stress levels. So what do you do for yourself to kind of just try to reduce your stress?
Oh, not enough. Nothing. That's a heated topic with me and I'm very transparent. If anyone goes to my TikTok, I'm very honest about our life. So this is something that me and my husband have an issue with right now. I'm not going to lie, is him giving me time to break away. So that way I can come back more put together. So maybe every once a month or every 2 weeks, he will keep the boys so that way I can just go away. And I just drive away, and we live in the mountains. So drive into town, maybe go to Starbucks, maybe take myself to lunch or just go sit at the lake. That's what I do. And what helped me the most was when I was working out all the time. So I would like to get back into that. Working out helps me feel phenomenal. So that's something I need to go back to. So yeah, that's what I'm trying to do. Not always doing it enough, but I'm trying.
Yes. Well, you're a very positive person. And I think you and your whole family are going to do fine. It's just a tough time right now. So I'm wishing you all the best. I look forward to seeing you in our community, participating. If anybody out there listening and wants to come back, email us at info@marybarbera.com and we will get you back hooked up in our community and our courses and our bonuses. And wishing you all the best, Zulekha. Have a great one.
Thank you. You too. Have a good one.